one of the most important areas of the pathology report involves stage. So staging is really an indication of how far the cancer is spread, in some cases how large the cancer is, and that can also be an indication of what type of treatment you need to have used. So staging is rated from 0 to 4, 0 being a non-invasive breast cancer that has not spread it beyond the duct. In some cases, they don't even remove stage 0 breast cancer. Stage 0 breast cancer is listed as non-invasive breast cancer. It is not, at this point, capable of spreading beyond its location. So, for example, lobular carcinoma, stage 0, what we call lobular carcinoma in situ, which is Greek for in place, would be something that we don't even treat. There's no hormone therapy used, there's no radiation, there's no chemotherapy. It's just something that you monitor for a while and see if things change. So just because you have cancer in your breast doesn't mean that it has to be an aggressive treatment regimen or that you should expect radiation or chemotherapy, not in every situation. Of course, the higher stage you go, the more likely you are to have chemotherapy, radiation, and in more cases, aggressive surgery. We talked about this before, but stages 0 through 3C are treated curatively. So the idea is to eradicate every cancer cell in your body, whereas stage 4 breast cancer, by definition, is not curative. This breast cancer has spread beyond the breast to distant organs, bone, brain in some situations. So the idea is to keep the cancer stable for as long as possible while maintaining a good quality. Stage is also determined after the surgery has been completed, because an important factor in stage is whether the cancer spread to your lymph nodes. So you can't always tell on a scan if lymph nodes under your arm have been affected by cancer. For example, my PET scan indicated that there was no cancer on lymph nodes. Remembering that PET scans can only determine cancer or only see cancer that's over 3 millimeters large, and the tip of this pen can hold 1 million cancer cells. So it's a whole lot of cancer cells that can evade detection. When they actually biopsied my lymph node, they determined that there was micrometastasis in there. So although my scan said node negative, meaning I was technically stage 1, my pathology report actually said stage 2 because my lymph node had some cancer cells in it.